Will radioactive iodine therapy cause permanent hypothyroidism? Imagine a treatment that targets your overactive thyroid cells directly, but often leaves you with a new challenge. Radioactive iodine therapy is a common approach for conditions like hyperthyroidism and thyroid cancer. It works by giving you a small dose of radioactive iodine that your thyroid gland naturally absorbs. This iodine emits radiation that damages or destroys overactive or cancerous thyroid tissue. The goal is to reduce excessive hormone production or eliminate cancer cells. However, because the therapy destroys thyroid tissue, it often leads to a significant reduction in the gland's ability to produce thyroid hormones. This damage is usually permanent, meaning most patients will develop hypothyroidism, a condition where the thyroid does not produce enough hormones. This is not accidental but a predictable outcome of the treatment. The extent of tissue destruction depends on the dose of radioactive iodine given, as well as individual factors like the size of the thyroid, age, and immune system status. Most people will notice signs of hypothyroidism within a few months after treatment. Some may experience a temporary phase called transient hypothyroidism, which can happen due to temporary damage or stunning of the thyroid cells. But in most cases, the damage is lasting, and the thyroid cannot recover its function. This means that lifelong thyroid hormone replacement therapy, usually with a medication called Levothyroxine, becomes necessary to keep your metabolism and energy levels normal. Symptoms of hypothyroidism can include feeling very tired, gaining weight, feeling cold all the time, dry skin, constipation, depression, a slower heartbeat, and thinning hair. Because this is such a common and expected result, healthcare providers routinely monitor thyroid hormone levels after radioactive iodine therapy. They often start hormone replacement as soon as hypothyroidism is diagnosed to prevent symptoms and maintain overall health. In summary, radioactive iodine therapy often causes permanent hypothyroidism because it destroys enough thyroid tissue to prevent hormone production. While some people may initially experience a temporary phase, most will need lifelong hormone replacement. This outcome is well understood and balanced against the benefits of effectively treating hyperthyroidism or thyroid cancer. If you are considering this treatment, it's important to discuss the possibility of hypothyroidism with your healthcare provider and plan for ongoing follow-up care. Always seek personalized advice from a medical professional to understand how this treatment might affect you specifically.